Dr. Milhan.
Yes, thank you. I just wanted to remind everybody that a febrile seizure is diagnosed retrospectively. A seizure happening to a family for 15 minutes is an enormous long time for a child to seize. So just when we talk about these things, and do I see in my practice that if a family has had a febrile seizure, are they excited to get the next vaccine? No. Am I excited to give them the next vaccine? No. It opens my eyes. Do we know that a natural occurring fever from a viral that is brought on not through a vaccine has the exact same mechanism as a fever that comes upon by a vaccine that is for a virus that in rare cases causes encephalopathy? We know that increasing temperature decreases the seizure threshold in all people. Right? That's well known. Is there an additive from the measles vaccine decreasing the seizure threshold more? So I think that's a question that's reasonable to ask, but to your point, Dr. Koldorf, I think families are very concerned. I think there's an increased hesitancy through all families right now. And I think that that's what we're here to do, is try to give them the best risks, benefits of these things as we can. Do we know, have the febrile seizure children seen first dose? Do we have long-term follow-up on all those kids?
The ask of us was to present data on risk of febrile seizure. I would have to go back and look at data with regard to longer-term outcomes.
Thank you. And next on the list is Dr. Stein.
Thank you. So I'm curious how the risks are communicated. Like, how is that actually done? Because I find it striking that a lot of this data you have existed before the guidelines, and so the guidelines were informed by those data. And then you also presented a lot of data that had been generated and published after those guidelines. And so I'm curious, since there is a parental choice here, how is that risk communicated to the guardians?
Let me ask if anyone in the SME room has the knowledge of that from the MMWR. Was there language in there on how to communicate, or has CDC produced documents on how to communicate? I'm not sure. I'm seeing if anybody knows.
Yeah, NCIRD SME room. We developed one-pagers for providers, how to talk to the parents. It was in a table format. These are the risks, these are the benefits, this is what it means. And we also, I think we developed a one-pager for parents to be aware of this increased risk with MMRV versus MMR plus V. So yes, we provided, call them communication materials to help pediatricians discuss this risk in a way that the parents would understand.
And this is Dr. Oliver. If we look at the usage data too, we know that 85% of the kids who are getting these vaccines are getting them separate at that first visit. So it's 15% kind of on average of kids that are getting MMRV at that first visit. Presumably after, again, the discussion with the pediatrician and the provider over kind of the risks and the benefits. Thanks.
Thank you. Next on the list is Dr. Griffin.
Thank you. Thank you for your presentation. There are studies that are suggesting lasting neurologic impacts in children. So I was wondering if there are any studies that the manufacturer or others are performing for children education performance.
You mean children after seizure?
After febrile seizure, I'm sorry, yes. And I have a comment afterwards.
Okay, I would again defer to experts within the SME room, please.
Hi, this is Julianne G. From the SME room. We are not doing any long-term safety studies, but if the manufacturers are available, they may want to comment on this.
And my comment to this would be, the product has been licensed since 2005. It would be helpful for parents to have that awareness or that reassurance that these studies are performed. A secondary question I would have is, are any of these studies tested against a true placebo, a saline placebo?
I'd have to get back to you on that one. There are most of the studies that I've seen are in comparison of MMRV versus MMR plus varicella separately. There were one or two studies where, well, I'll hold over there and I can get back to you with a firmer answer if desired.
It is difficult to decipher then the risk if we're comparing MMRV versus MMR plus V. Then does this not automatically hold us to a confounding factor? The retort to this typically is that it is unethical to hold a vaccine versus true placebo study because it's unethical, because the sentiment is that the vaccine is considered safe and effective. However, I think that is probably the most ethical thing to do in a day and age where parents are, through full informed dissent, not getting their children vaccinated. And I will share from a perspective, I have seen parents who have opted to not vaccinate their children be some of the most educated people I've spoken with, bringing in studies and showing their rationale for not vaccinating. And so in this day and age where we do have, I believe, a rising percentage of parents who are not vaccinating in an informed manner, I feel that it is ethical to invite those parents for such a study and say, okay, since you are making this informed choice, let's study this. So I think I would invite that idea to have a true placebo study. Thank you.
Let me ask the IRD SME room if they have a comment on the